Hi, my name is Dr. Rudra Mohan, and through the Oral Health channel, today we're going to be talking about who is an oral pathologist and what do they do. Let's start. So this is a very extensive branch of dentistry which goes up to the molecular level or the microscopic level of the disease processes that are happening in our mouth, teeth, gums, palate, bones, everywhere. So oral pathologists are the somewhat in the essence the backbone of all the research that happens around dentistry, because they are the tissue specialists, they are the normal microscopic feature specialists, and they also know what goes wrong and what are the patterns that you end up seeing in the microscope when it comes to the disease process, what markers get elevated in the disease process, what markers get elevated in inflammatory processes, what markers get elevated in any sort of carcinomatous processes. And these are the people who really know their way around the microscope. All the probable diagnoses which are confusing or conflicting in terms of similarity of symptoms, the end result is usually a biopsy when it comes to an oral pathologist making the section under the microscope, observing it and finding that characteristic or pathognomonic rather feature that differentiates the actual diagnosis from the other similar diagnosis from microscopy. These individuals are trained rigorously in how to understand the tissue, the cytology, the techniques of frozen section preparation and the techniques of microscopic section preparation. They are also very well versed with identification of the morphology of normal teeth, the normal oral structures, and anything that is abnormal, which is not only clinically correlated but also related histopathologically. Histopathological examination, when it comes to especially the oral mucosal lesions, it is always the gold standard when it comes to finding out what the exact diagnosis is. And it's very rare that you might have something that is completely similar disease processes which are clinically very similar, but ultimately it's the oral pathologist who will know microscopically that this disease process is not one particular process, it's the other one, based on differentiating features or pathognomonic features that are seen under the microscope. They are trained very rigorously in order to learn about the cytological markers. These markers can help in providing information about the healthy tissue, also providing information about inflammation or the fact that any sort of carcinoma or cancer causing agents, the cytological markers that are present, these are used for research. So their most of the job is basically around clinical and basically histopathological research, where they study the trends of all the types of disease processes in helping our clinicians at the forefront to find out what are the actual ways we can use to differentiate various disease processes. At the same time, what all strategies we can use in terms of treatment as well as prevention. So this was today's episode. Please like, share and subscribe, and do press the bell icon for important updates. If you want to get in touch with me, here are my social media handles and my WhatsApp number. Kindly refrain from calling directly as I might be busy. Just drop me a message and I'll get back to you within a couple of days. If you have any queries, doubts, apprehensions or insights, please feel free to put them in the YouTube comment section. So that's it for today. Thank you.